The Better Sleep Explained virtual event.
Good morning and welcome to Better Sleep Explained. I'm Natasha Ray, joining you live from Zoomer Hall. 80% of Canadians don't get enough sleep, and that certainly affects our quality of life. I'm one of the lucky folks who can fall asleep and stay asleep, sometimes a bit too long if you ask my family. But the vast majority of Canadians are battling some form of sleep issue. Today, we are going to be discussing sleep, starting with Dr.Iris Gorfinkel. Dr. Gorfinkel is a family physician who maintains a full-time general practice and participates in clinical research. She's here to talk to us about why we sleep and why we need to sleep better. Welcome, Iris.
Thanks so much for having me.
Thank you for joining us today. So I'm going to start by asking you, what is the role of sleep in overall health and longevity?
I'll answer that question with another question.
Okay.
What part of life does sleep not affect? In my view, we're being far less too aggressive in treating it and understanding it. So when it comes to physiologic, both mental and physical health, it makes a tremendous impact. It's used as a torture in some parts of the world because of that impact. So I think we need to make the most of what it can do for us physically and emotionally. There is no psychiatric illness that is not associated with a lack of sleep.
That's an interesting fact. I didn't know that. But one of the things you and I both know is how important it is to keep your family doctor involved with all of your healthcare needs. So if someone is having sleep issues, when should they see their family doctor?
You know, it's such a simple answer, but the answer to that is actually when they feel tired. Okay. If a person feels tired, it's a subjective thing.
Right.
That's what determines it. And moreover, if there's a change from what the baseline was. So I was one way before, and if that baseline has long been, I'm a little tired, but now it's changed. That's what I look for as a GP, a change from that baseline.
So when you talk about baseline, you mean, so if I was sleeping 8 hours a night and it was wonderful, and then for the last 2 months I've been sleeping 4 to 5 hours a night and it's terrible sleep, that means the baseline has changed. Like when do you start to think, okay, this could be a problem now?
Right, so there's that number, but there's also subjectively, a person with sleep apnea, for example, could sleep for 10 hours and yet have literally 30 minutes of nutritive or good quality sleep.
And that's another good point, because just because you've had a long sleep, it's about quantity versus quality. The quality is more important than the quantity. So what are some of the common things that disrupt someone's sleep? And I know as you start to list some of these that I probably am the culprit of all of them, but just for fun, why don't you tell me?
Well, you know, let's divide it up into two categories.
Okay.
There's primary sleep problems in which the sleep architecture has been disrupted. You know, so that would be things like obstructive sleep apnea. And then there's the far more common thing. This is the mundane stuff that a GP does. What keeps the vast majority of people awake? Why can't they sleep? The answer to that is stress.
Yes.
Stress is by far the most common. But as a GP, I'm looking to exclude other things, physical things, serious emotional problems. You know, so as a GP, I come at it from the perspective of, let's start with the wide umbrella so that we can better understand what it is that your body is trying to tell us by this change.
And is there a specific type of person who tends to suffer from sleep issues more, or it is sort of across the board, like it could be any age, any gender, any ethnic group?
Oh, absolutely. It's pretty much everybody.
Right.
But the common things being common. You know, caffeine and alcohol play a tremendous role in disrupting sleep potentially.
So sometimes people think, well, if I just drink a few glasses of wine, it'll help me feel more relaxed and then I can go to sleep. But is that the quality of sleep that you want? Like, how does alcohol consumption actually affect your sleep?
What's interesting is that alcohol is a sedative, and there's a difference between sedation and sleep. So what does alcohol do? Alcohol disrupts the sleep architecture, making it harder, actually, to get a nutritive night of sleep. The sleep tends to be more fragmented. In other words, people wake up more frequently. Even though they can fall asleep a little more easily, what we have is sedation. And alcohol also impairs what we call REM sleep. That's the sleep that's nutritive and gives us a sense of having slept well. It tends to happen more at night, and alcohol targets REM sleep to damage it.
That's good to know. And so if I wanted a real nutritive night's sleep, like what do you recommend? What is your best advice for how I can do this?
Best advice.
Yes.
Make sure that the room is dark. If I had to say the one thing that was most important, same time to bed, same time up every single day. Caffeine, and this isn't popular to say, but alcohol actually belongs in the morning, because if you're having it at night, what ends up happening is that it does disrupt your sleep. It's more likely to do that.
Alcohol belongs in the morning.
Well,
you heard that here. Alcohol belongs in the morning. Okay.
No, what you heard here is this. Let's be aggressive about sleep.
Right.
Let's take sleep as seriously as we take diet. We're not doing that right now.
Yeah.
We take diet so seriously. We think about paleo, we think about veganism, we think about all this stuff. And what happens to sleep? It gets relegated to the passivity of life, and that's not acceptable. We have to think of it in terms of a proactive thing as important as exercise. How am I going to ensure a good night's rest? So the list of sleep hygiene: keep the room dark, keep the room cold, same time to bed, same time up every day, including on the weekends. This stuff matters. Exercise, we know it improves both the quantity and the quality of sleep. Diet, exercise, sleep, these are fundamental to cardiovascular health, to psychological well-being, and to staving off dementia.
And these are the things I've heard constantly, is about the exercise and falling asleep at the same time and waking up at the same time. And certainly the fact that I fall asleep to a different murder show every night probably is not helping with my own nutritive sleep.
Well, the idea is 1 hour before going to bed. It actually makes a difference.
Right.
By 50% in terms of how quickly people fall asleep, just turning down the lights. This one simple thing, you turn down the lights, you stop, and this is so hard to do, you stop looking at your mobile device, because that mobile device will keep you awake. So there's all this stuff about blue light, but it's also the stimulation that goes into it. You know, the FOMO, the fear of missing out, oh my gosh. And then what winds up happening is your mind is extra active. Yes. The meditation makes a huge difference. You know, number one thing, stress. So you've got stress that you can actually control and stress that you cannot control. And I think what meditation does is it allows us to rise above those things that we cannot control, concentrating on our breathing, concentrating on how we're actually feeling, our sensations in our body. And that in turn leads to a much more nutritive night of sleep, as opposed to sedation that happens from drugs. And we know those drugs. I'm talking about the benzodiazepines. I'm talking about the Ativan, the lorazepam, clonazepam, Valium, diazepam. These drugs on the negative list. Yeah, they'll put you to sleep. It's not sleep. Remember, it's sedation, different architecture altogether. And they make people forgetful. They make it more likely they're going to fall, more likely they're going to fracture, and less likely they're actually going to have a nutritive night of sleep.
Well, I really like your message. We need to be aggressive about sleep. So thank you so much for joining us today. I know this was very insightful for me, and I'll work on having a more nutritive night's sleep. So thank you.
Many thanks for having me.
Thank you.